Have you ever wondered why menopause has men in it? Menorrhagia, menarche, menans. So guys, in today's video, I'm going to be speaking about menopause. Menopause is one of those topics in women's health that I am quite passionate about. I've been privileged to manage some women with menopausal symptoms. That said, let's delve right into it. What is menopause? Menopause is usually diagnosed a year after a woman had seen her last menstrual period, provided that she is not on any hormonal type of contraception at all. And the reason why I said this is not far-fetched. I've seen a couple of women slide into my DM being concerned about being menopausal. And then I ask, are you on any contraception? And they're like, yeah, I'm on Mirena coil. And I'm like, yes, Mirena coil can pause your menstrual period for up to 1 year. It doesn't mean that you're menopausal. Having said that, I know that a lot of people already know that a female fetus would have had all the eggs she would ever have at 20th week of gestation. These eggs are immature eggs, of course. And at birth, she would have 1 to 2 million eggs. And at menarche, which is the age at which she sees her first period, she would have about 300,000 to 500,000 immature eggs. And from that age of menarche, where she sees her first period, she will continue to lose eggs every month. And you might be wondering, if she's got 300,000 eggs, how come by the age of menopause she wouldn't have any eggs left? The reason is because more than 10 of those eggs would be recruited every month, and the most mature of them all would pop out during ovulation. At ovulation, when that egg pops out, it leaves its shell behind, and its shell would produce progesterone, which basically helps to nourish the implanted egg, or rather the implanted embryo, in an event where that woman had unprotected sexual intercourse, which led to a pregnancy. In the event that no unprotected sex happened or no pregnancy happened, the shell would and the egg would just disintegrate. Now let's pop back to menopause. So at the age of menopause, a woman would usually have no eggs left. So what happens when there are no more eggs? It means that that oestrogen that the egg will usually secrete and that progesterone that it's gotten from the shell of that egg would be no more. By the age of menopause, a woman would usually have no eggs left, and the ovaries will literally be empty. So what are those symptoms that a menopausal woman would experience? Before I go further, the average age of menopause range between the age of 45 to 55 years. So if a woman goes into menopause before the age of 40 years, it is said that the woman has experienced premature ovarian insufficiency. So what are the symptoms of menopause? Remember that menopause means no more egg left, which means no more estrogen, no more progesterone. So what are those symptoms that you feel when your estrogen and your progesterone is no longer there, when your body is no longer producing adequate estrogen and progesterone because you've basically depleted your ovarian reserve? The symptoms would be, for the purpose of this video, I'm going to be starting from head to toe. The first one is hot flushes. The woman feels that drenching heat that comes from nowhere, and before you know it, she is sweating. The second thing is brain fog. They start losing their memories. The third one is depression. A woman in a menopausal age can suffer with depression. She could have low mood, reduced appetite, low energy, tiredness, lack of interest in what she normally enjoys. And that is why, if you are not really versed with menopause, a woman over the age of 50 or 49 years comes to you and she presents with these symptoms, what will come to your mind? You might think that, oh, this woman is depressed, and then you just unknowingly pop her on antidepressants. Of course, the antidepressants will help with the hot flushes, but how about the other symptoms that she's experiencing? So let's go further. Coming down to the chest, we are talking about cardiovascular symptoms. A menopausal woman could experience or be at an increased risk of a stroke or a heart attack. Coming down, we are talking about the genitourinary symptoms, which could include low libido, that is lack of sexual drive, painful sexual intercourse, which could happen due to vaginal dryness and the fact that the vulva and the vagina itself has shrunken, is smaller in size. And some women could also present with increasing urinary symptoms. You see that you're managing a woman who keeps coming with recurrent urinary tract infection. You've already ruled out other sinister causes of UTI. But then again, she still continues to have symptoms. You've given antibiotics, probably even started on prophylactic antibiotics. However, she still continues to have urinary tract infection. And then all of a sudden, you give some topical oestrogen, and then she feels alive again, right? Low estrogen, menopause could increase your risk of having recurrent UTIs, right? Now let's talk about hair loss in menopause. Shrunken skin, that glow basically disappears, right? So how do you manage menopause? How do you manage it? You basically manage menopause by replacing the hormones. So when you hear HRT, HRT can sound so cumbersome, and then you're scared. Oh, what is HRT? I'm on HRT. HRT causes this. HRT basically means hormone replacement therapy. And what you're replacing is the estrogen and the progesterone. Now, the type of HRT that you start a woman on will depend on whether she has womb or whether she doesn't have womb. Yeah, if a woman has womb, then you wouldn't want to give estrogen alone. You'd want to give a combination of estrogen and progesterone, right? If she doesn't have womb, then you do not have to worry about the risk of womb cancer. Because what happens is that if you continue to give estrogen alone, the woman's womb lining would continue to get thicker. And what happens when the womb starts getting thicker? It takes only one abnormal cell to go gaga, and then cancer starts thriving. And you see a woman whom you started on estrogen only HRT coming with post-menopausal bleeding. You send them for an urgent post-menopausal bleeding scan, and then they come back with thickening of their womb. You send them for a biopsy, and then they come back with womb cancer, and then you lose your license. So managing both is basically different. Does this woman have womb? Do they not have a womb? Have they had womb remover? Then if they've had womb remover, then you don't have to be worried about cancer, womb cancer, and then you can just start them easily on estrogen only. But if they've got womb, you have to do the two. So what are the contraindications to hormone replacement therapy? If a woman has had a personal history of breast cancer, don't do it. And if a woman has had previous unexplained bleeding from the vagina, that needs to be investigated. If a woman has hypertension, you might be wary to start HRT. So now, how about women who are still seeing their period, but they are already having hot flushes, they're already experiencing menopausal symptoms? What do you do with them? Those women are said to be in the perimenopausal period because they're still seeing their period. Probably it's no longer as regular as it used to be. So what do you do for them? There's a special type of HRT that you can give to those women. I forgot to add to the symptoms of menopause that some women in the perimenopausal period could start having more and more increasing bleed. They can have heavier menstrual period. And sometimes now, if a woman is like, oh, I'm already taking the progesterone pill, which is a hormonal progesterone pill, just give me estrogen, I'm fine. Don't listen. And the reason is because desogestrel is not licensed to be a part of HRT. Only Mirena, Levocet, Benelexa, those ones are hormonal coil, which can also help to prevent womb cancer.
I forgot to talk about women who have contraindications to HRT. How do we manage them? We can offer them an alternative to HRT, some special types of medication called SSRI. Venlafaxine is a good one, which we can give them, and that can help to control their hot flushes and their depression and other symptoms as well. I also didn't talk more deeply about people who have genitourinary symptoms of low libido and painful sex. We can give them some topical Oestrogen gel, and then we can also advise them to go on both oil and water-based lubricant. When they mix it together and then apply it down into the vagina, it can create that gliding natural effect of juicy lovely vagina, such that they wouldn't have that painful sex anymore. Thank you.
Did you find this video informative? Kindly let me know in the comments. And don't forget to share this video and save for later. You might be helping someone without even knowing. Thank you.